Hi YouTube, it's Misty. So today I am coming with a very overdue update. I feel like it's probably been forever, and it might have been. But there's a lot going on, so I want to update everyone as to what's going on right now, and we'll go from there. So I had gastric bypass surgery on April 24th, 2013. At that time, I weighed 377.5 pounds. I had a BMI around 67.5. Today, I weigh 165 pounds. I am approximately 27 months out. And I'm happy. Anyways, so big news. The first big news I'll give you is I think it's next Friday on August 14th. I am going to be in my bariatric surgeon's 2015 campaign. It'll be a professional photo shoot and video shot in his office with him and the surgeon. And it'll be like shots of like me working out and like having like one-on-one doctor time and stuff like that, and just like regular pictures. And they will go on the doctor's office's wall. They'll go on the website. They'll go in the brochures, and they'll go in the commercial. So I'm really excited about that. And I'm more honored that they would even choose me. And they already use me in their seminars and things like that. You know, like when people come for the first time to see if they would be interested in the surgery. And my doctor always tells me that I am the superstar. You know, I've lost a lot of weight, and I remember being in them shoes and thinking that's not possible. But it is. And I don't think that, people really get that until maybe they're like, you know, someone who's done that, or, you know, the surgeons operated on someone who's done that. So I think it means a lot to me to be chosen for this, and I am really excited. Second is today I had my pre-op visit with a plastic surgeon. I am having a paniculectomy. It's basically a tummy tuck though without muscle repair because it's so extensive. It is the Fluer-De-Lis or the anchor cut or the upside down T. And I'll kind of explain more in a minute as to the incisions and why. And that is going to be on August 26th, so just a few weeks away. I got all my stuff squared away, pre-op stuff. I have some pre-admission testing and see the anesthesiologist and things like that. I do have to get not a clearance, but, I have issues. You know, you all know that I had a blood clot and a pulmonary embolisms after my Roux-en-Y. They came to find out after genetic testing, there is nothing that I'm genetically that I'm likely to ever have again. It was probably my weight and the estrogen caused from the NuvaRing that I was on both times. Anyways, my surgeon is afraid to put me on Lovenox injections. He kind of wants to as a precaution, but he's afraid to because of the likelihood that I will experience other complications due to the Lovenox injections. You know, it can cause hematomas, it can cause more bleeding, and it could cause a likeliness that I will end up back in surgery. So he is afraid, and he is going to discuss that with my hematologist, hopefully in the next few days, to discuss my post-op care and how they're going to do that. They did decide today that it will no longer be outpatient. They are going to keep me in, which I am thrilled about because that means I'm not coming home with oral pain meds. I am terrified of pain. I don't handle it well. So now I know that I'm going to get IV pain meds for at least the first 2 days. That makes me thrilled. Otherwise, they told me no more dieting. They said I'm actually quite small underneath this stomach, and they don't want me to lose any more weight. They said I could end up malnourished, and they need me to stay where I am. So that's quite odd to hear. That stop losing weight. Like my whole life I've been hearing lose weight, lose weight. Every doctor, I'd go to urgent care with a sore throat and they would tell me to lose weight. And now they're like, don't lose weight. You're fine. So that felt good. Otherwise, during the surgery, they're going to move my belly button. They're going to pull up my kitty cat and make it nice and tight. They're going to do everything I want, and my insurance is covering it. And I mean, basically the surgeon is doing the Fluer-De-Lis cut and the belly button, all of that for free. Like, you know, my insurance is only paying for the common paniculectomy. But my surgeon is awesome, and he says he's not going to leave me unhappy or feeling deformed. Anyways, I'll show you my skin real quick. I have to go to the bathroom though to show you, so I can set this phone down. Let's see here. Let's see if this works. If I just set. Okay. Hopefully it stays there, guys. I don't know if it will. Oh, see, I knew it wouldn't. Alright. Maybe there. Okay, so I'm going to try to do this without showing you my other issues. So, okay. So, with the Fluer-De-Lis cut, or the anchor cut, they will be cutting me from basically hip to hip, first of all. That's the first horizontal incision. It'll be from, you know, this hip, and he said they might go over a little bit further just to maybe try to, so I don't have that dog ear or bunching, whatever that is. And they'll go all the way, and they'll go all the way over to like here. And then the vertical incision, I mean, it'll start like right here, and it'll kind of go like this, like on both sides, like, and it'll meet the bottom one. And then, of course, they'll take the, you know, the belly button and they'll move it. However they do it. I don't know. But anyways, and then they'll bring it all and they'll just snap it shut. I don't know. I'm not the surgeon here. I'm just doing kind of what he told me. But anyways, he said my incision would actually come about here. You know, like when it's all said and done, it'll be like right above where I have this, you know, where my nastiness kind of stops. Because they want to get rid of all of this. Because you can see I can pinch all of this all the way up. So they want to get rid of all that. I mean, you can see, like, when I do that, you can see just how, trying not to, but I mean, you can just see that I am actually, I mean, you can see the shape of me, you know, in that. You can see my ribs. I mean, that skin, that's nasty. But anyways, then if I turn this way, and this is like the way that's kind of most telling for me. It's kind of gross. Like it looks, I don't know. But anyways, here. Hopefully you guys can see that. Like you see how that's just like, it's like a drape. And you can see my hips perfect here. And you just see that drape. That's what I'll be happy is gone. But I mean, you can just, I mean, it's just, I mean, he didn't tell me how much he thought it weighed. He said it was at least 5 pounds though, so I'm hoping 10, but I'm probably being a little bit too much there. Anyways, so anyway, I just wanted to kind of put that out there. Give my befores, since I don't know if I'll make a video again until my surgery. I mean, I might do like a pre-op day before surgery or something like that. I don't know. But I'm nervous. I'm mostly nervous because they're saying, they're saying there's a high likelihood of healing issues, and then throw in the fact that I have these other issues. I'm really hoping that they don't make me take the blood thinners, and I'm afraid of the repercussions if I don't take them and then I actually needed them. I don't know. I guess this is why you pay doctors, so you don't have to worry about it. But it's kind of terrifying. I don't know. But I just gotta not worry about it and know that I'll be okay, because I will be. All right, though, that's it for now. We're going on 10 minutes, and I don't want to go over. So I'll make another video maybe the night before or maybe from the hospital. I don't know. You know how things get around that. But I'm definitely going to update after, if the day of or something like that, so you guys can at least see how I'm doing. It's August 26th, and then when I do get my commercial, I'm going to post that too. Bye, guys!